Rapid spread of a new COVID variant that scientists around the world are racing to understand.
So here to answer your questions right now is Dr. Ali Raji, the Executive Director Chair for Emergency Medicine at Mass General Hospital. Dr. Raji, it's great to have you with us. Thanks for your time. And it's really important every day, and it's important today. The World Health Organization moved very quickly to identify Omicron as a variant of concern. So let's build it from the foundation up. What makes this one different, and what makes it so troubling?
It's a great question, Ed. It's about what we know as well as what we don't know. Now, we know that some of the mutations that Omicron has have been seen in other variants and have made them more transmissible. So the concern is that this could also be transmissible like them. We also don't know where it is just yet. There's a number of countries around the world, including many in Europe and Asia, as well as Australia, that have reported cases. So we don't know exactly where it is. And the concern is that it could be spreading widely across the globe.
And the belief is it might be in Canada as well, Dr. Raji, which is obviously our northern border.
Right.
All right, and we don't know yet if the Omicron variant causes more severe disease. How long do you think it will take for us to get that answer?
Shayna, it shouldn't be longer than a few weeks. The countries that we all just talked about are looking at the hospitalizations that they have and sequencing the virus to determine which of the variants is leading to those hospitalizations. So we should know in a few weeks whether it's Omicron that's leading to these surges.
Dr. Raji, the variant has not been identified and detected here in the United States yet, but logic says it's here already. And the president said today it's only a matter of time. So is there anything that your staff in the ER is doing differently right now to prepare for it?
Ed, it's all about the basics. During my shift over the holiday weekend, I can't tell you how many times I put on and took off N95s and gowns and full face shields and goggles and gloves and everything else. And we're all doing that. And fortunately, we have been doing it for many, many months and a couple of years. We just need to double down on being exceptionally careful. The other thing I've got to tell you, me and a bunch of my coworkers have found that we've been pretty successful in talking to patients about getting vaccinated. So I think we're going to double down on those efforts too, to help the people who are a little hesitant.
And with that said, most Americans are relying on vaccines and boosters to protect us from variants. Do you think we need to take any additional steps right now, such as putting that mask back on indoors?
Shannon, not just yet. We don't have a reason to think that the vaccines aren't going to be effective against Omicron, and we should know more about that soon too, as Pfizer and Moderna and J&J run those tests. In the meantime, we need to make sure we're doing all the things that we already know we need to do. Masking up in a public setting, or if you're in an area of high transmissibility. Make sure that you stay home if you're feeling sick. A lot of people are going back to work these days, and that's important not just for COVID and Omicron, but also for flu, because we're about to enter flu season.
Dr. Raji, thank you so much for your time. It's great to see you.
Thank you both.